How can inflammation within the temporomandibular joint create the symptom of ear pain? Well, that's what we have to talk about very specifically and very easily. So first of all, let me share a screen with you and pull up a diagram of the external auditory canal and the glenoid fossa, which is the socket part of the temporomandibular joint. Let me get this going here. All right, hopefully you can see that. And let me point out a few things. This is a diagram directly out of a 1953 edition of Gray's Anatomy, which was gifted to me by the chairman of the Department of Anatomy at Indiana University when he found out that I couldn't afford a Gray's Anatomy, and he reached behind him and he gave me his personal copy. I cherish it. 1953 edition with his name on the inside cover. This diagram is, let me get you oriented here. This is the external auditory canal. This is the bony part of the external auditory canal. And this is what is called the glenoid fossa. It's the socket part of the ball and socket of the temporomandibular joint. You can see immediately how close these two items are. This is posterior. This is the front of the face out here. This is the posterior part of the temporal bone. This is the anterior part of the temporal bone. And the juxtaposition or the closeness of the posterior part of the glenoid fossa, which holds the ball and socket of the joint, to the external auditory canal. It's very, very close, and it is so close that when this particular joint becomes inflamed due to damage within the joint, damage being caused by one of three causes, most common cause is bruxism meaning clenching and grinding, also caused by acute trauma to the face and the jaws. Most common issue there is whiplash, which is seen frequently in automobile accidents, and then functional malocclusions where the bite is so bad, the bite is so uneven that it overloads the joint, causing damage within the joint.
Ask your dentist if they are a TMJ services provider.